Okay, so we're going to talk about new ways of thinking about fat transfer. If you look at aging over a period of 20 years, you can see that with relatively standardized photography, if you will, maybe some more makeup than before, you can see that over 20 years it looks like there's brow ptosis, dermatochalasis, descent, but if you really measure those brow heights, they're about the same, and the right eyelids come down a little bit, but the left eyelids actually retracted up a little bit, so no real net gravitational impact that you're seeing over 20 years. It's principally volumetric loss. If you take a narrow time frame from early to late 30s, you can see that the early 30-year-old face is already narrow. There's early signs of hollowness, but it really becomes much hollower over a period of 5 years. And so you got to think of the aging face like a glass of water emptying. Why use this model? Essentially, it's a way to communicate to patients. I think it's very helpful. I'm going to talk about it more in a second. But if you think about fat loss, it really, if you ask most women when they thought they looked the best, if they're matured past 35, they oftentimes say around 32 because there's too much volume in 18 to 22. So if you say that, there's this emotional connection where the woman says, oh, I understand he doesn't want to put too much fat on my face and he gets me. And it's usually there's a smile that they understand that 30, 32 is actually typically a better volume state. And if you sort of take aging from 1 year old, 10 years old, 20 years old, 30 years old, 40 years old, and you continue, you look at those photos and you just conceptually think about that aging process. It's volume loss from 1 year old all the way to 80, minus weight gain that could occur. So people ask, is fat grafting permanent? We're going to go more into detail about my philosophy regarding that, and the answer in short is yes, but obviously you're going to age. So I look at this as filling yourself up to an ideal, and then with each year that transpires, you lose a little volume because that's the natural way of aging. You just lose some of your own natural fat, typically not the transplanted fat. So I'm going to sort of briefly go through this. You've heard a lot from Val and from Mark about understanding the blink concept and structural shape, how you can sort of recognize someone from 20 feet away and see that they look youthful or they don't, even before wrinkles set, even before you recognize wrinkles. Why is that the case? Well, it is overall shape, and there's this slow evolution of shape change from a full circle in childhood. As you get into the teenage years, there's still a full circle. And then when you get into the early 20s, that circle starts to change over to more of a loss in the buccal area, but not very much by the mid to late 20s. It starts to dominate more by the late 20s. And then when you get into the early 30s is when you're starting to get that more sculpted appearance. And that sculpted appearance starts to give way to frank hollowness by the late 30s to early 40s, and then some more dominance in the lower face, so more of a squaring off effect. And then as you start to hollow further in the face, again, with weight being static, you start to see the lower face start to dominate in your perspective, and then you can see truly orbital hollowness and much more attention to the lower part of the face, or reverse the triangle. So initially what I thought about a good way to understand aging is reversing the triangle, but I think a more eloquent way that I've been starting to understand things is that oval is more of an ideal. And that's what Mark was alluding to earlier, which is the concept of really getting the buccal area perfectly filled so that you can create a good transition from upper to lower face in terms of overall rejuvenation. So the concept is not making triangles, but making ovals. So this is an example of a lady that has a pretty large malar bone, and you can see that with that shape, the goal is to actually fill the anterior cheek and the buccal area, and what that's going to do is going to soften that malar prominence, so there's more of an ovalization of the face and blending effect. Over here, what you can see here is that she's got, a relatively full buccal. There's a little bit of hollowness, and it actually sits right underneath the cheekbone out here. I divide the buccal area into three areas. The area subzygomatic, far laterally, or backfill area, sort of the central buccal area. And then as we don't see this as often now, but as into the 60s or 70s, we start to have, if there's poor dentition, some medial buccal hollow where it starts to cave in medially. So I conceptualize the buccal area into those three areas. And this, to me, is a little bit of posterior buccal hollowness, but not significant amount. And by blending that down and then blending across the jawline, you get a very nice combination. She did have laser, and she also had an upper blepharoplasty in combination. This is an example of an Asian face that has more of a wider buccal area and a wider lower outer face. And so to de-emphasize that, I filled more the central cheek, didn't do anything to the buccal, did anterior chin work. And a way that I sort of explain this to patients to understand how balance works, and this is part of the aesthetic or artistic element of it, is that if you look at a glass of water on a television screen and I ask you how big is this glass of water, you'll say I have no reference points, I can't answer that question. But if I put a shot glass next to it, you think the first one's big. If I put a pitcher of water next to it, the first one looks small. And so that concept of balance is how I look at a face and just try to see, just like when you do rhinoplasty, you want everything to be in harmony. Longevity. So I do a lot of hair restoration in my practice, and it was a model with which I started to understand longevity. So as I was studying for the hair boards, I started to look at Unger's book and started to see, why does hair take so much time to grow? And the reason for that is there's a process of neovascularization after primary inoculation and secondary inoculation. And so I really see that fat transfers start to transform over a period of a year to 2 years. It's just a different model of looking at it. A lot of people blame it on stem cells, or why they improve over a year. Some people think they gain weight over 1 or 2 years. I personally think there's something, a maturation process that occurs over 1 or 2 years through a long-term vascularization of the graft itself. So if you sort of follow this, I see initial swelling early on. I call this the dip over a period of 3 to 6 to 9 months. There's variability in this. And then I usually tell my patients, don't panic with this, because there should be overall a softening effect. And then you start to lose a little bit more, and it's never as swollen as your initial 1 month result either. So you got to be careful not to convince them that the 1 month result is a final, where all the wrinkles are stretched out and they look almost perfect. And I think that's a misleading time as well. This is just to sort of follow through. This is a 1 week photo of a 48-year-old lady, and you can see over about a month. To me, this looks pretty good. And then at 3 months, maybe it looks better with a little less swelling, and then over 6 months, you start to see her hollow a little bit out, and you start to wonder, is that going to dissipate? And then over about 11 months, you can start to see it fill in. And then over 15 months, you can see it fill in. The only other thing I did for her was Botox, no skin treatments, nothing else. And this looks like the lighting is different. It's the same room with controlled lighting. And I don't use fill-in lights. I really challenge you to, if you're going to do volume work, if you do a lot of fill-in lights, you just can't see any of the changes. It gets washed out. And I think this is a more representational quality to how we see each other's faces in real life. We see each other's faces with top-down light, whether we're outdoors or indoors. So I try to simulate that and have you see the faces the way that you would see it normally, rather than a controlled studio setting with 2 washed out lights. Just a matter of perspective. So another element of hair restoration is the concept of donor dominance, where hair harvested from the back is moved to the front and it behaves like the hair from the back of the head. I think that's the concept of understanding why fat is so weight sensitive. I always say the #1 risk with fat grafting is weight gain afterwards, because where's the first place you gain weight? Where's the first place you see it when you gain weight? It's in the belly for men, and the women will be thighs and belly, and that's where you harvest from. That's why I think there's a tremendous durability with that. However, there's also the negative, which is you got to be careful with weight gain, and that's why I think people that are early 20s and mid 20s, when you're using it for reconstructive purposes or being aggressive in your application, you have to be very careful. I think that the older you get, the safer it is, almost like hair restoration, because there's a better track record of understanding weight safety and understanding long-term outcomes. This is maybe recipient dominance. Is there influences of the skin? Is a donor area influencing the skin? Is the skin is there back and forth plays or softening effect? I don't know. I mean, we'll talk a little bit at the end about some thoughts of what I have about stem cells, but I don't think it's entirely clear. And then, or is it just a fact that there's the graft has gotten better over time? And so people always say, what things could you do to make your fat graft take better? And I'm always very hesitant, because I always say, I don't want my fat to take better because it's going to be too full. I sort of know predictably where I put it, what I put in it at day 1 will give me what kind of result at year 1. It doesn't mean my results are perfect, but I don't want a result that's too perfect, because if you overfill, it's even a worse situation. It's very hard to rectify that. I almost want to get them to about an 85% result. And I really believe that if you fill a lot of little areas of the face, overall you create such a good result that you don't have to worry about one little area being perfect. That's when you come in with maybe a little filler and manage it, because fillers are much more precise than fat. Fat provides the best foundation for the entire face when it's global. When to use implants versus fat? There's a lot of talk about using alloplast for aging the face, and I like the concept of like replaces like. I think it's an easy way to understand this. So if you think about fat loss, as we talked about, that's really where we are today. We don't lose a lot of bone. We do lose bone, but in the era of good dentition, I think the bone loss is proportionally less than the amount of soft tissue we lose as we age. And so if that's the case, then I think we should look at replacing soft tissue. Why should we do that? Well, if you look at aging, the soft tissue envelope starts to disintegrate faster than the bone loss, and so your margin of exposure of bone actually starts to become more obvious. So if you put an alloplast in, you actually expose more bone, and you actually increase transitions and increase bone exposure appearance. So that, to me, is maybe not the right answer for aging in the face. So obviously, if you're doing a great job with alloplast, great. This is just a concept I like to talk about. So we go back to the aging model, and if you understand fat transfer, it increases that distance. So I think that by covering exposed bone, you create more of a favorable highlight to shadow ratio, and also cover bone that you can't see. So you see how much bone is on the right versus soft tissue on the left. So again, implants, in my opinion, exacerbate shadows. Fat transfers diminish those shadows. And if you think about is fat transfer then the beautiful answer for everyone? And I believe that that's not the case. If you look back and see that what I was mentioning, a lot of the metabolic changes long term are real problematic, that implants in general may be safer in younger people with more metabolic changes over their lifetime, that you can remove the implant down the road and they have a better soft tissue envelope to cover it. Whereas you get older, minus weight fluctuations, perhaps it's better to use fat grafting in people that really need soft tissue volume versus hard tissue alloplast augmentation. So like replaces like is a concept that I think helps understand that. This is a gentleman that had a chin implant and liposuction. I don't think he needs fat grafting in there. So this is just sort of a nice table to how I sort of articulate this to a patient. Is a fat transfer someone older, how old? That's a relative term. Just like when I do hair restoration, I think the older you are, the safer you are. The implant, the younger you are, the safer you are, in my opinion. You're welcome to disagree with that. And then I believe that like replaces like, as you see, and really the major thing, as you heard from most of the speakers talking about fat, is that weight is a real critical issue when you're talking about long-term safety. Stem cells, just in conclusion, there's a lot of stuff going around about this. I'm not hard convinced that the stem cells are making the changes in the face, as you heard my earlier hypothesis, but I think they are. It's very, very rich in stem cells in the adipocytes that are down in the belly area. So I think that there's probably a concept that it probably is affecting something. I just don't know well enough to make a comment about it. The book we wrote, if there's any questions, my email. And what we can do is, I do have a 5-minute video if there's not a lot of questions, but otherwise, I was just going to show the tear trough, because everyone wants to know how to do that, because that's the hardest area to do, but it's pretty simple if you start doing it. We can field questions before that. Any questions?